Hello everyone and welcome to another Wellness Wednesday. Kind of exciting for several reasons. Time flies. Apparently this is number 50. 51 if you want to get technical because we did 2 segments last week. But I didn't realize until Facebook gave me one of those reminders last week that on this day a year ago, whatever, and I had sent out the event reminder about the very first Wellness Wednesday, and it didn't really dawn on me because I guess we weren't to 52 yet, but that's because we skipped a couple weeks, right, at Christmas. So technically this is a year of Wellness Wednesdays. Yay! It's kind of fun. So yeah, time flies when you're having fun. I don't have as much information as I was hoping to have to share with you today. However, it is still some good information. So last week in segment 2, I talked all about the information regarding clarifying the different types of testing, what they showed, what's realistically going to be available to the public versus someone who actually is admitted to a hospital, and just how all of those different tests interplay with each other. And then I also, ironically, I think it was the day or two after I did that talk last week, I also came across a story on the Today Show where some medical correspondent or something, some doctor was in the hospital and they were, talking about how he was on his deathbed, but all 4 tests he had taken were still negative. And they never used that platform to clarify and discuss then why we need other types of testing like the stool PCR and the antibody testing. He's on, oxygen, laying in the bed, very, very ill, and the rapid tests and the nasal swab PCR are all negative. So clearly his viral load is low, but he's still very ill. The first thing they should have done after one negative test was the antibody testing to see where he was in the infection cycle, where his immune system was in terms of fighting it. But they didn't do that. So I shared that information myself. So go ahead, look back and share that. So I think it bears repeating and continued attention in terms of testing and what is available. And so I wanted to share today the new lab that I got an account with last week, which I mentioned was Diagnostic Laboratory Solutions. And the reason I did that is because they offer, I think they're the only one, so if someone can prove me wrong on this, correct me, but the doctor that did the interview, who is a co-founder of this clinical lab, said they were the only lab doing this. So not that Great Plains Labs antibody testing is not valid. I have clarified with them that their ELISA kits are made in the US. They're not one of the janky kits from Asia. And that everything was CLIA and internally certified and validated in terms of their procedure. So as we talked about last week, there's a lot of information coming out about janky testing, right, for antibodies, and that's because with the FDA and their emergency use authorizations, they, in order to ramp up testing, had to, let in as many people as they could, and that let some of the bad in with the good. So Great Plains is still good. I can still order their antibody testing from them, but if I'm going to start doing the stool PCR as well, I might just end up ordering both from Diagnostic Solutions. So nothing bad with Great Plains, just more options, more availability. I know it took a couple weeks for the first couple tests that I ordered from Great Plains to even get shipped because of the COVID, what do you want to call it, formalities now of everything having extra precautions surrounding shipping and packaging and cleaning and all that kind of stuff. So I'm just trying to find the best options to get things to people the quickest. I have no information on the pricing yet. That was what I was hoping to square away this morning by talking to my rep, but obviously they're very busy. So instead, I'm just going to share some of the information about the testing that they've given me. And as soon as I know anything on the pricing, I will let you know. Other big news is that I am going to begin offering blood draws in the office. So it wasn't something that I had done before for a variety of reasons. But I have finally decided that given the circumstances, it is one less step for at least people who are local, one less barrier to care, if you will, if you get the testing kit from me, than to have to go somewhere else to do the blood draw. So Blood draws will be available in office for $25 soon. I have almost all of the supplies that I need. I'm just waiting on one more piece of equipment, and I think we'll be good with that. So as far as the testing, so we talked about last week how to clarify what antibody testing companies or kits are good. And so Diagnostic Solutions Antibody Testing, their ELISA kits are also made in the US. Everything is CLIA, which, let me see, I can't remember now. CLIA means, I don't know what it means. CLIA certification ensures our laboratory meets or exceeds US standards set for laboratory excellence. Clinical Laboratory Internal Accreditation, maybe? I thought that was on there. So anyways, the kits are good. This is a great lab. They're, where does he have it on here? The information sheet. Their assay demonstrated 100% analytical sensitivity and specificity in a study of 84 cohorts. So what that means is internally in the lab, the machines themselves, every time a sample was run, 100% of the time they got the right outcome for a known sample, which is how it should be, right? The equipment should always be giving you the right answer. Now, that's analytical sensitivity and specificity. That's not clinical, which means now in the real world, getting real samples, that might be something different. But it's in the high 90s, like 90. They have to have the EUA approval from the FDA. They have to be, I believe it's around 95% or higher. So it's all good with their antibody testing, and just a refresher that it is a blood test and it is best done on serum. They can do with whole blood, but serum is best, which means I need to get a centrifuge to spin it down and get the serum off. It is going to be better than the blood spot or the finger prick test, which may not contain enough blood to perform the test adequately. So I know initially I was really excited about the blood spot coming down the pipeline from Great Plains, even though they still have no information on when that would be available. But I think the stool PCR is going to be far superior to that. So in regards to kids, so my kids, for example, I'm going to be ordering them the stool PCR test, because you just take a piece of poop and they run the exact same PCR test that's done with the nasal swab. But what's interesting about that is that what they were finding is that because of viral shedding, the stool sample could be positive for up to, I believe it was close to 5 weeks after a respiratory sample was negative. So here's why I really like this lab and why I like this option for the stool analysis. And again, the FDA has only said that the nasal PCR is diagnostic, which means you can't do the antibody testing or the stool PCR, get a positive result, and get a positive diagnosis, because the FDA hasn't said so yet. So that doesn't mean this information is not useful. Obviously, it just hasn't gone through all of the bureaucratic paperwork yet. So antibody testing is going to be great in terms of a current or previous infection, right? That's the big thing, because we want to better understand the spread and just, community transmission and things like that. So I just want to, so it can be used in both symptomatic and asymptomatic patients. It's a useful tool in identifying patients who have been exposed to COVID-19. So again, you don't have to be actively sick to do this. This is a critical test. It will help practitioners understand the trajectory of SARS-CoV2 virus and its spread. And again, the IgM antibodies are detected earlier in the course of infection. Studies published to date indicate its detection within the first week after symptom onset, and then peak within 3 to 4 weeks, and then begin to decline, whereas IgG are often detected after the first week of symptom onset. Although longer-term trends have not yet been established, previous studies in SARS indicate that these antibodies peaked within a few months after symptom onset and then gradually declined thereafter. So again, if your antibody test comes back positive we're not guaranteeing immunity. So anybody who's saying that they're guaranteeing immunity or making sure you're immune, you can't make that claim yet because we don't know that. We're only going to know that retrospectively. But as I said, what Dr. Brady said is that we are going to assume, because we have dealt with SARS and MERS in the past, which are also in the coronavirus family, is that immunologically it will act similar. So what that means is if you have the IgM or IgG titers, IgG namely, right, because that means you're past the infection, you will have some amount of sustained immunity for a period of time, but we'll never know how much or for how long until this is all over, right? So we'll see. It is an RNA virus, single-stranded, just like the flu, and we know the flu changes every year, right? So even though we have a flu vaccine, it's only 30 to 40% effective. I don't even know how they come up with that number, but we still have, I think it's in the ballpark of, I saw this morning an article, 40 to 90,000 deaths a year from the flu, even with the flu vaccine. So just keep that in mind. Like we're right there now with this infection, okay? So this will be important to understand. So antibody testing, as you said, it's not fully been established, but because of the previous studies in SARS, we know that the IgG antibodies were present, they peaked, and then gradually declined. So will this virus mutate? Will we need to, get another course of exposure and another course of immunity, kind of like rhinovirus and the common cold? We don't know yet. We don't know. But this will help. This will get us started. So the following individuals can benefit from antibody testing. This is the big question I get. Should I get the antibody testing? I don't understand. Should I do this or should I do this other one? You can do the antibody testing at any time, okay? So this test can be for people with already a confirmed diagnosis of COVID-19. It can be for someone with a suspected but unconfirmed diagnosis of COVID-19. And even for asymptomatic patients, whether you think you've been exposed previously to SARS-CoV2 or not. Again, because there are so many mild and asymptomatic cases, it's going to be important to do this testing so that we know what the spread really was. And again, as I've said, this is not the sole basis for diagnosis. The FDA hasn't approved that yet. So the exciting thing then, beyond the antibody testing, like I said, is the stool testing. So why this is really cool is because research from, and I'm going to read this because I don't want to mess any of this up. This is really important. Research from around the world indicates that as many as 50% of patients who were positive for SARS-CoV2 experienced gastrointestinal complaints. So this is something I find kind of crazy because you hear it mentioned, once in a while, but if it's half the people, why aren't they talking about it more? Furthermore, evidence suggests that SARS-CoV2 is detectable in stool, and its presence in stool can last for up to 5 weeks after clearance from the respiratory tract, meaning that your respiratory nasal swab PCR test might be negative, but your stool PCR might still be positive, which suggests, as we understand how science works, that this could be a fecal-oral transmission. So this would be furthermore important, just as much, if not more, than the antibody testing, because if you were someone who did have a mild or asymptomatic case, and you went out in public, you could still be spreading this for up to almost a month and a half afterwards, right? And how do you know? Because you don't even know when you had it. So I think that these two tests are going to go great hand in hand. So a recent article published in The Lancet states that data suggests the possibility of extended duration of viral shedding in feces for nearly 5 weeks after the patient's respiratory samples tested negative for the SARS-CoV2 RNA. Although our knowledge about the viability of this virus is limited, the virus could remain viable in the environment for days, which could lead to fecal-oral transmission, as was seen with severe acute respiratory virus CoV, which is SARS from the coronavirus family, and MERS, the Middle East Respiratory Syndrome coronavirus. Okay, they're all in the same coronavirus family. Therefore, routine stool sample testing with the real-time PCR is highly recommended after the clearance of viral RNA in a patient's respiratory samples. Strict precautions here could help prevent transmission for patients who are either in the hospital or self-quarantined if their fecal samples test positive, So again, this is really important if someone is already confirmed for ongoing, we say surveillance is probably not the best word, but to continue to work with a patient to understand at what point they're fully clear of the infection, right? So obviously, coronavirus stool testing offers an important adjunct test to the NP or nasal pharyngeal swab. So that's the big old stick that they're sticking up people's noses. So the stool test then is helpful for the following individuals. Obviously, anybody exhibiting symptoms, right? Fever, cough, shortness of breath, or gastrointestinal symptoms. Asymptomatic patients who are concerned about having or transmitting the virus. So I don't know, maybe you're someone who thinks that you may have been exposed, you weren't confirmed or diagnosed, but now you're considering whatever maybe your work is or the role you play in the community, and you're wanting to ensure that you're not going to spread it around. And I know that's a concern for people. So this is a great test. And then obviously, again, surveillance of patients who previously tested positive by respiratory samples. So the stool test stuff, I think, is going to be just as huge, if not more, than the antibody testing. And then, sorry, there was one more. I nailed this all together. Nailed it. Stapled it. One more page because I wanted to share some of the other studies that were done on this. So the key points here being that SARS-CoV2 in stool may be found in up to 53.4% of COVID-19 patients. The virus may be detected in stool for a period of days to weeks after initial infection. And intestinal viral infection may play an important role in COVID-19 in terms of the disease progression, and that it may increase the risk for more severe disease. So this is an important tool that should be used to prevent fecal oral transmission. So this was one high fecal viral levels found in COVID-19 disease and in asymptomatic carriers. So again, in about 23% of cases, patients were no longer positive in their respiratory samples, yet stool samples were still positive, okay? So this is clearly underlining the value that fecal testing is going to have, stool testing. Data from 98 COVID-19 patients showed viral shedding in the stool for nearly 5 weeks after the samples were negative, as we've said. Another study reported that patients shed the virus in their stool for 30 days after infection. Even asymptomatic carriers can show elevated SARS-CoV2 in their stool. Therefore, it is recommended that routine PCR stool testing be done to determine when it is safe to discontinue precautions in recovered COVID-19 patients so as to prevent transmission of the virus and best allocate medical resources. So if we're really going to have this conversation about when do we reopen, how do we reopen, are we just going to overwhelm the system then, right? Because essentially all we did with this was just kick the bucket down the road, right? Like it's still going to spread around until it's gone through everyone. So if you really want to get into the nuts and bolts of it, of when it's going to be appropriate for certain people to rejoin society, open their businesses, whatever, this is going to be incredibly valuable, right? Especially, because up to this point we've been talking about this 2-week window. Well, now we know it's more than a 2-week window, right? So if you think you've been infected, you have been infected, and you are 3 weeks out, 5 weeks out, and you want to know, you're worried about getting out in the world, you should be washing your hands anyways. Let's put it that way, right? Like we still know soap and water is the best way, okay? So this is just under the assumption that there are dirty people out there that are not going to wash their hands. Wash your damn hands. That's the easiest solution. But if you're still concerned, this is going to be one of the best ways to find out when you're fully not transmissible anymore. The direct link between COVID-19 and the gastrointestinal tract. So this is interesting. SARS-CoV2 gains entry into the host via ACE2 proteins. We already know that. They're found in the lung epithelium, which is what everybody's obsessed with, right? Because that's where we see the most symptoms. But little known fact, it's also in the gut epithelia. So the gut could also present as an entryway into the host and be a site of viral infection. So they did a study and they found that 2 to 18% of patients with COVID-19 had diarrhea, abdominal pain, and vomiting. 10% of the patients presented with diarrhea and nausea 1 to 2 days before they developed the fever in the respiratory symptoms. And in some cases, digestive symptoms were in fact the primary symptom for COVID-19. So, GI symptoms with COVID-19 may indicate a more severe course of illness. For example, abdominal pain was reported more frequently in patients that were admitted to the ICU. And again, SARS-CoV2 can be detected in stool specimens of asymptomatic patients. So they're making this connection, right? You're seeing gastrointestinal symptoms prior to the onset of respiratory stuff. They're seeing that the majority of the people going to the ICU are also having gastrointestinal symptoms, indicating what? We're going to get to it in a second, but just think about that, because I've talked about it before. If your immune system isn't strong and you're susceptible, where does everything start? Just think about it. We'll get there. So, the presence of SARS-CoV2 in stool points to, obviously, as we've talked about, the potential of fecal-oral transmission. Asymptomatic individuals could therefore be spreading it unknowingly, although this remains to be proven. However, this does present risks for both, medical personnel who have contact with patient's stool, and additionally, think about it, all the endoscopic procedures that get done, right? Anybody who's in the mouth, who's going down the throat, anything like this, or from the other end, okay? Looking up through the colon and the intestines and all this stuff. So anytime you're going to disrupt the gastrointestinal tissues or mucosa, from either end, might be another thing to be concerned about. So here's the big, bring it all together. And it's just funny because as I read this, I was going, yes. The gut microbiome may have a role in lung health. Duh. In respiratory tract infections, pathogens invade the airway and multiply. Yep, we know that. Infection depends on the number and virulence of the pathogens, but more importantly, the host's defenses. So you hear these news stories about, a 30-year-old healthy individual sick with COVID in the hospital for a week. Now, granted, they didn't die, right? They recovered. But what made them healthy? You don't hear anybody talking about how to have a truly resilient immune system. And I'm not going to say strong, right? Because then you get into the realm of autoimmune diseases where somebody's immune system is so out of whack that it's overreacting and actually attacking the body. That's what autoimmune is. So what we want to say is that your immune system should be well balanced. It should have a proper response, and it should be resilient to infections. It should respond appropriately, not too much, not too little. Kind of like the three bears, right? But think about that. As soon as I read host defenses, I circled it. Look at this. I did. I circled it, and I wrote 70 to 80% of your immune system's in your gut. Ding, 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 ding. How many more of these dots? Do people... this is what I've been talking about for years. This is what naturopathic doctors have been talking about for years. So they go on to say acute respiratory infections such as influenza can initiate dysbiosis in the respiratory and gastrointestinal tracts, which means it's messing with your body's natural bacteria. We do have good bacteria in our body. They help us. They do good things for us. So this can promote the development of secondary bacterial pneumonias. In some studies, oral probiotics have shown protective against influenza virus pneumococcal infections and ventilator-induced pneumonia. This points to a possible strategy of improving the gut microbiome to improve immune defenses and prevent respiratory infections. Boom. Do we say mic drop? Just a little. Optimize your gut health to reduce the impact of coronavirus infection. Given the role of SARS-CoV2 in gastrointestinal infection, GI symptoms, and disease severity, a healthy GI tract could reduce infection and/or severity of COVID-19. By optimizing gut health, we may be able to protect patients from further complications caused by SARS-CoV2. How do I do that? Every single frigging day. The Carroll method. It's the only method of dietary assessment, whatever you want to call it, that identifies foods that are not compatible with your body, that cause inflammation, chronic inflammation, that damages your gut. Another post I did a week ago, Hippocrates, all disease begins in the gut. The man said it 2,000 years ago. It's still true. 70 to 80% of your immune system's in your gut. If your gut is full of bunch of food that damages your body, that crushes the 70 to 80% of your immune system, that weakens your body, of course the infection is going to take a hold there. Why wouldn't it? It's like, hey, perfect storm. And yet people, say, well, I'm healthy, but then they have Mountain Dew and cupcakes for breakfast and wonder why they get so sick. So, see, there is a lot of lifestyle that is not being talked about. We need to talk about how to truly be healthy and take care of your body and eat good food and eat foods that are compatible with your body, not incompatible and causing problems. So, yes, back to this same old stuff. I love this testing. I think it's going to be super valuable, but I love the fact that they use the studies out there and the real cases, and they're connecting the dots and coming to the same conclusion that everything I do is based on and has been based on, and everybody before me in my profession has based their careers on: treating the gut. Probiotics, non-inflammatory foods, taking care of your gut, supporting your immune system. Those are the things that make you healthy. Those are the things that make your body strong, that prevent this virus from getting a foothold in the first place. So you want to talk about who's healthy? It's not the people who are sick. You cannot have health and illness at the same time. Just because someone was a runner and they were deemed a 30-year-old healthy person who was in the hospital for a week with coronavirus, that's not a healthy person. The healthy person is the person who got a mild or asymptomatic infection and didn't bat an eye. That's the healthy person, okay? So I think this testing is huge. I'm going to do the stool testing with my kids. Now, do I think they've been affected? I don't know. I don't think so. But then again, they're healthy. They don't eat their food intolerances. They don't get refined sugar. They only get organic whole milk and water. They get plenty of sleep. They have a good schedule. They take probiotics and cod liver oil every day. And they've never been sick. Never. Once I got shanghaied into giving the older one antibiotics. It didn't help. It didn't do anything. And all I did was spend 3 months restocking his gut with good probiotics. So I'll forever kick myself on that one. But otherwise, my kids have never been sick. And I'm not worried about it. But I also would like to give my family and friends peace of mind. So if I test my kids and they're clear, then we know we're good to go. And if they get a little bigger, someday, maybe we'll do the antibody testing. I can't bring myself to do that right now. Taking a vial of blood out of an 18-month-old who's never been stuck with a needle before, that seems like a lot of trauma to me. So that's where I'm going to leave it for today. I have another phone call I have to do. So thank you for joining me. I see many people are watching. Thank you, thank you, thank you. And please share this. Like I said, the stool testing is only, as far as I know, being offered by this one company right now. So antibody testing in combination with the stool PCR, much more information, right? A much bigger window of information for you to help you move forward. And obviously, as always, if you have questions, let me know. And as soon as I get confirmation on the pricing, I will definitely be sharing that as well. So, all right, I think this was really good information today. So I hope you guys enjoyed it. And thank you for joining me. And I will see you all next week. Take care.